Let's review the support available to migrate to cash pay. In the early days of the cash pay movement, patients had to be diligent shoppers and look for sources that provided reduced rate cash pay service prices. As medical service providers began to recognize the benefits, they made cash pay discounts more readily available. Every patient who paid in cash helped to reduce the administrative overhead associated with that provider's insurance relationship. Primary care medical practices not only embraced reduced cash pay rates, but they also began converting their practices to a direct primary care business model. With direct primary care, patients have the option to pay the practice a fixed monthly membership fee in return for drop-in or short lead time appointments, with all services provided through the practice, including the cost of membership. In other words, members could see their doctor on short notice with no added cost for services. As time moved on and new technology became available, some of these same family medical practices invested in the communications technology necessary for them to deliver telehealth services directly to their patients. This new virtual direct primary care was the forerunner of what is now called virtual primary care in the telehealth industry, whereby telehealth memberships can now connect patients with the same doctor every time they call, drastically expanding the diagnosis and treatment capability of the doctor. It goes without saying that medical cost-sharing communities have been pursuing cash pay service providers for almost 30 years. The greater the demand for cash pay services, the less resistant there was to providers. Ultimately, it simply became a common part of the provider's business model. The government made it official in January of 21 when the Department of Health and Human Services began enforcement of hospital and insurer price transparency rules that require all insurance companies and medical service providers to publish both insurance and cash pay services. Just like GoodRx became a prominent brand for providing a common place to locate the best price for prescription drugs, companies like MDSave and Savos Marketplace are becoming go-to sources for reduced-rate cash pay medical services.